you are doing a Simman Station in Plab 2 exam, like you are on airway, from where you can get the instrument, from where you can get the things to complete your airway part. Breathing, and there is some bees in the chest, from where you can get the ventilator salbutamol. Hello guys, assalamu alaikum. My name is Dr. Faraz Ahmad, and today I am here in Pakistan. I am here on the wedding ceremony of my brother. So I'm making this video particularly for those candidates who are going to appear in Plab 2 exam. Definitely, if you are going to appear in Plab 2 exam, you must be aware of Simman Station. And if you are aware of Simman Station, you must be aware of A to E approach. You must be aware of ABCDE approach. So in this video, I am going to let you people know, like you are doing a Simman Station in Plab 2 exam, like you are on airway, from where you can get the instrument, from where you can get the things to complete your airway part. And like you are doing B, you're doing breathing, and there is some B's in the chest, from where you can get the ventilator salbutamol to give the nebulization. The third part is you are on the circulation C, from where you can get the things to complete the C part, and the things are like IV lines, fluids, blood vials, from where you can get these things. So please keep in mind, while you are working in the NHS, a very good system is over there in the application. Like different types of trolleys are there with different drawers. Most of the time these trolleys contain 5 drawers. And on every drawer it is mentioned A, B, C, D and E, and sometimes it is mentioned airway, breathing, circulation, D and extra. So please keep in mind, while you will be there for your Plab 2 exam in GMC test center, unfortunately it will not be mentioned on the trolleys, but the things will be in the similar sequence of the mentioning. Like in the first draw of the trolley, it will be consist of the things of airway. In the airway, you can get some instrument to remove the foreign body from the airway. You can get nasopharyngeal, oropharyngeal airway. You can get the non-rebreather mask or the venturi mask. You can get the nebulization mask from the A trolley. And in the B, the second draw will be mentioned, although it will not be mentioned in the GMC exam, but the things related to breathing will be in the second draw. Please keep in mind, second draw will be breathing. Like you can get salbutamol, you can get hypotropium bromide for the nebulization from the draw B. What does it mean? From the second draw of your trolley. And now you are doing the C part. You are on the circulation of the Simman Station, and now you want what? You want cannulation. You want cannulas of the different sizes. Please keep in mind, you have to always try to use large bore IV cannula that is green color. Okay, you can get the IV cannulas, you can get the blood vials, you can get the fluids from the third draw. That draw will be consistent with circulation. Okay, please keep in mind, this is the normal protocol being followed everywhere in the world, like in Pakistan, in England, in NHS. This type of the scenarios, this type of protocols are being followed. And in the D, you can get the things related to D. In the E, you can get the things related to E. Okay, so now I am going to show you like from where you can get these type of things. So here you can see this type of trolleys are normally being used in the NHS with the mentioning of A, B, C, D and E. You can see A for airway, B for breathing, C for circulation, D for drugs and E for extra. So while you will be there in GMC test center for your Plab 2 exam, and when you will be doing your Simman Station, please be aware of these things. What does it mean? Please be aware of these things. Like please keep in mind, as I mentioned earlier, like in the test center on the trolleys, A, B, C, D, E will not be mentioned. At some time, instead of this type of trolleys, you can get the drawers or the boxes being fitted in the cupboards on the wall of the examination center as well. So what you have to keep in your mind is, if there is trolley, like if there is a trolley given in this picture on the right hand side with the white color, then you are supposed to be aware of this color scheme. So you can see there are 5 handles, like 1, 2, 3, 4, 5. So you are presumed to be known that you are aware in the first draw there will be things related to airway, in the second draw there will be things related to your breathing, in the third one things will be there related to circulation, and in the fourth one things will be there related to drugs. Like different drugs including your IV drugs, your nebulization drugs will be in the D. So then in the E part or in the E draw of your trolley, there will be things related to your extra things. Like in the E we normally do exposure, and if in the exposure we find something that is not normal, then we do the things. Like what we do in the E, normally after the exposure we do the catheterization of the patient. So what you can do, you can find the catheter. Like if you are going to catheterize the patient in the exam, you are supposed to take the catheter from the E of this trolley. So this color scheme, this coding of ABCDE of Simman Station in the Plab 2 exam must be aware in your mind, or you must be clear of these things in your exam. So here I am showing you this picture. This picture is basically from a hospital. Currently I am working in Bedford General Hospital, and I have taken this picture, this short video from the trolleys which are present there in our department of the medical emergency. At last but not the least, you should be aware of the different things, or you should be aware of the coding. Coding is A, B, C, D, E. And you must be aware of, like, first draw is A and the last draw is E. So your sequence will be A, B, C, D, E. And now I am going to show you different pictures which are present at the moment in different NHS trusts. So color scheme could be different in different NHS trusts, or it could be different in the GMC exam. Sometimes it could be dark, it could be grey, it could be white, it could be yellow, or sometimes it can be some other color. But the important thing which I have just mentioned to you people is that you must be aware of the code, which is A, B, C, D, E. So what does it mean? It's mean when you are on A, when you are on the airway, if you are in need of something to clear the airway, to remove the foreign body from the airway, you will be in need of some instrument, and that you can find from the A draw of the your trolley. And if you need some oropharyngeal, nasopharyngeal airway, you can get that from the airway trolley as well. In the similar way, if you are in need of any of the masks like non-rebreather mask, venturi mask, or the nebulization mask, you can get it from the A. And if you are in need of any of the drug like Ventolin, ipratropium bromide, you can get it from the E. And if you are in need of the IV cannulation, IV fluids, IV blood vials, then you can get these type of the things from C, circulation box. Okay, so apart from that, if you are in need of the catheter, as I have just mentioned, you can get it from E draw.